Welcome to Inside Urgent Care, the podcast that shares stories from within, you guessed it, the side of healthcare we all know and love, urgent care. This is the space for you to hear inside perspectives and authentic conversations from those working in the space. Thank you for being here, and let's get into it. Hello, and welcome back to Inside Urgent Care. I'm Samantha Wolf, and today we're joined again by April Gillum, Head of Industry Strategy and Consulting at Solve Health. Today's episode is Hot Months, Cool Strategies. So without any further ado, I'll hand it over to you, April.
Thanks, Samantha. I am happy to be here. At this point, I feel like I'm just, that cousin or neighbor who's just kind of always around the UCA. So again, I'm April. I am the head of industry strategy and consulting at Solve. And before I came to Solve, I was the chief operating officer of Urgent Care for Kids by Goodside Health. So today we are going to start out, as always, with looking at some data, trends, and news that affect urgent care. So first, I want to talk about this summertime COVID spike and how it's affecting urgent care, or if it's affecting urgent care at all. What urgent care operators should know about how the summer 2024 COVID surge is affecting our patients, our providers, and our businesses in terms of impact is this. So clinically, the too long didn't read is this. Despite the increase in cases, the protection people have built up thanks to rounds of vaccination and prior infections is still sparing the vast majority of people from severe illness. And that is directly from Stat News. And they gathered that from Dr. Aaron Glatt, who is the chair and professor of medicine at Mount Sinai, South Nassau. And so it's really not clear how many people have COVID at a given point because of lack of testing or reporting. And so because so many infections are mild, that many people don't even think to test. And so you're probably seeing that at your centers where people come in with symptoms and they actually don't realize that they have COVID. You're testing them for maybe flu, you're testing them maybe even for strep, and it comes out that they have COVID. So the metrics like wastewater data and hospitalizations do show increased COVID activity in recent weeks. And the latest CDC wastewater numbers rate viral activity as high in July, though still far below a steeper uptick in January of this year that is in turn dwarfed by a giant peak in January 2022 when Omicron first came out. So wastewater numbers are the highest in coastal cities and major metropolitan areas. Comparatively, there is a modest uptick in emergency hospitalizations, and the weekly reported COVID-related deaths is still at its lowest point since the virus emerged. So, all that being said, the virus is still relatively mild, and we're seeing that we have more positives in our clinics. But in terms of how it's impacting our volumes at our clinics, let's take a look at that. So when we look at online traffic, so online traffic is search activity for urgent care and actual booking data in terms of urgent care and for COVID visits, what is that telling us? When we go to Google Trends, there is a significant increase in COVID search traffic. And when we go to actually Solve, where I work, there is a moderate increase in COVID-related bookings. So some consumers are aware that there is a surge happening. And so there is some awareness there. But there has not been a significant correlated increase in urgent care online bookings in general or discharge volumes as a result of the COVID surge. And that's seen in the search activity that you can see in Google Trends. So if you go in Google Trends and you just compare, COVID versus urgent care, we're not seeing a significant lift in urgent care on a national basis. Now, search is highly local. So if you go in your local area, it may be different in your local area. And I encourage you to go search on your local area and look at Google Trends. But on a national basis, that's not what we're seeing. So again, the too long didn't read there is that at a national basis for urgent care, yes, we are seeing more positivity rates for COVID right now, but it has not significantly impacted our overall volumes and online bookings for COVID visits. So for patients in the general public, what we can do for our patients to actually increase volumes is we can educate. So we can stay top of mind. We can lean into the summertime symptom messaging. So we can use tools like SMS text, and we can say, hey, are you having these symptoms? Did you know that there is a COVID spike? The people who are the most at risk are the immunocompromised and the elderly. Come in so that we can test and treat you. And know when school starts in the community that you serve. So the virus could uptick more at that time because, of course, children will start to congregate. And we know when that happens, that viruses of all kinds start to proliferate. And then you want to leverage reporting tools to see demand patterns. So, of course, you can use Google Trends. If you are, a Solve partner, you can use our tools. So you want to be on top of the patterns with the patients that you serve and the communities you serve to be able to leverage those tools appropriately. So that's what I encourage. Let's take a look at what's happening with Medicaid. And I realize that Medicaid, a lot of times people are like, why are you talking about that? It's not super fun. It's not super quote unquote sexy to talk about. But, more people than ever are on Medicaid, and it is a population that we serve, and we need to talk about it. So I'm going to talk about specifically Medicaid in Texas. And you might say like, well, April, I don't serve Texas, but I do believe that what's happening right now in Texas has implications for what could happen in the rest of the nation. So let's talk about it. So Texas officials have rejected attempts by several major insurers for families that they've served for 20 plus years to cancel a proposal that will drop them from state Medicaid programs and shake up about 1.8 million covered lives. And this is what I mean. So Texas Children's Health Plan, Cook Children's Health Plan, and Driscoll Health Plan have served Texans for about 20 plus years, and they are local community-based health plans. And the thesis behind having local community-based health plans on Medicaid is that they can engage the members of that community better and that they can keep costs lower because they're helping them plug into primary care, into specialists, and into urgent care, keeping them out of the EDs when unnecessary, and also keeping any chronic diseases managed before they become catastrophic. And so these three community-based health plans, again, have served the state for a very, very long time. And I want to point out that Medicaid in the state of Texas, that is actually the largest contract that taxpayer dollars go towards. And in our nation, Texas Medicaid contracts are the largest that our nation has. So when this happened and the state of Texas officials decided to drop these three community-based plans, they decided to drop them in favor of national for-profit insurers, which are Aetna, United, Blue Cross Blue Shield, and Superior, which is backed by Centene. And the other thing that's concerning here is somehow the national insurers got access to the RFP before the local community-based insurers had access to them. So this is concerning for a number of reasons. It's concerning for the taxpayers. It's concerning for the most at-risk people in our community. This is, the low-income children, low-income pregnant women, elderly, and disabled. And then this is also concerning for urgent care operators who operate in the state of Texas, because this will disrupt their contracts. I've operated in these areas, and I know that some of these health plans actually paid the best for urgent care operators. And so this is going to disrupt their the contracts and their net revenue per visit in this local area. And so seeing how this plays out through 2025 could set precedent for other states in our nation. And so we should be watching what happens here as urgent care operators, no matter whether you live in Texas or in another state. So the third thing that we want to look at here that is better news is we've had some merger and acquisition news. We know summertime for urgent care is the right time to actually both have mergers and acquisitions and to open new centers. So recently it was announced that Urgent Care for Kids by Goodside Health, which is actually the company that I used to work for, led a recent acquisition of the Houston area locations of the Pediatrics Medical Group Primary Plus Urgent Care Clinics, formerly Nightlight Pediatrics Urgent Care. And there were 11 centers that were acquired there, bringing urgent care for kids and their total clinic count to 24, which I believe brings them to the largest pediatric urgent care in Texas. So congratulations to Urgent Care for Kids by Goodside Health. All right, Samantha, I believe that's going to take us into the next section, which is hot months, cool strategies.
And if you opened an urgent care center this summer, congratulations, and thank you so much for your commitment to community health. Thank you.
Okay, let's head into our hot months, cool strategies section. And, it's a little bit of a punny title, but this is a time that unless you are in a destination town, typically July and August, they can be slower months for us in urgent care. And so it's really important that we leverage these months to prepare for our upcoming busy seasons and dial into operational rigor, into building up our teams, and to building up great patient experiences. And so that sounds like a lot, but if we take it just a little bit at a time every single week, then we can achieve great things during this time of the year. So let's go through that now. I really like to center and start with our people and take a people first approach because they are the heartbeat of our clinics. We can put the best tools, the best technology, the best website, the best building around our urgent cares, but without our teams, we are nothing. And I've been hearing from so many urgent care operators that they are struggling with their teams. And a lot of what I hear is, April, this Gen Z, team that I have, these receptionists, these MAs, they turn over so much. They just don't want to work, yada, yada, yada. And I hear it's a them problem. And what I don't hear is, hey, I'm learning about Gen Z and I'm changing the way I operate to show up for them. That's not what I'm hearing. And that's the way we need to be operating. So what I really want to challenge you to do is to reboot your recruiting, your hiring, your onboarding, and your engagement with a people first lens and looking at who your people are, how they learn, and how they're motivated to activate them. And understanding that you are not going to change the core of who they are, but you can understand who they are to achieve your common goals. And so I want to give you an example. This new generation that you may not understand yet that is coming into your clinic to work for you, they've grown up with a phone in their hand and social media. And you can use that so that you can achieve your common goals. And so instead of training them in classroom settings for hours or, giving them videos that are hours long, give it to them in quick bites. Show them how to do things in quick bites in 1 to 2 minutes long and make it fun. Make it digestible and fun. If you're going to roll out a new tool or technology, then do, little quick commercials and bring them into it. Bring some sort of receptionist champion and say, hey, do you want to make a little TikTok type video about this new tool we're going to roll out and make it fun with us? And make it really clear about the value that this new tool or technology is going to provide for them. And I promise you are going to have so much more success doing things like that than trying to give them an SOP document and get them to learn off of paper. Now, yes, the SOP document may follow your TikTok video, but the adoption and utilization and understanding of why you're doing the SOP will be greater in conjunction with a small quick bite video than if you did not have something like that. So I really want to, again, challenge you to reboot your recruiting, hiring, onboarding, engagement with a people first lens. Understand who your people are, how they learn, and how they're motivated. So then the next thing that I always look at in our hot months is our operation strategies. And again, with that people first lens, after our people are fully trained, understanding in our clinics our alignment. And, if our teams are not aligned, especially not just our core clinic teams, but our providers, then it really impacts our total operations, our door-to-door times. And we can't see that just on spreadsheets or just on reporting. We have to be in clinics live to understand that alignment. I've been to several clinics here recently, what I call not so secret shopping with my kids. And I have observed providers who are seeing one patient at a time, fully documenting and discharging them before they will move to the next patient. And I promise you, you cannot see things like that on reporting. You have to be able to see things like that live to coach a provider on seeing patients at the same time and being able to work 2, 3, even 4 patients at the same time. And that is a skill and a muscle that has to be learned and has to be taught by another seasoned provider. It can't be replicated without really great teaching. So the next thing that I really emphasize is processes. We have too much waste in our processes, and it's been built up over the years. We'll just add another step and add another step without evaluating what we need to take away. And so this is the time to time clock your visits and understand what in your visit flow does not make sense anymore. Remove steps that don't make sense and try to get everything you can into the exam room. Do not create steps that are walking in and out of the exam room unnecessarily, and then remove handoffs when you can. For your tools, so many urgent care centers have faulty tools like duct tape culture tools. So this is the time to repair, replace, and also augment tools when necessary. So if you know that you should have, one, I'm going to say, you should have one Sophia machine for every X amount of patients that are seen a day. And I'm going to say Springfield clinic, because there's so many Springfields in the United States. Your Springfield clinic sees 120 patients a day in the height of respiratory season. Well, let's go ahead and get more Sophia flu machines, right? This is the time to make sure that you are not limiting your potential capacity in the respiratory season. Let's go ahead and get the tools now. And then our technology. Now is the time to dial into our technology and make it great. If you're not working with an interoperable EHR or EMR, this is the time to go get one. We want to make sure all of our technology is connected. We also want to make sure all of our team is really trained on how to use that technology properly, that it's adopted properly, that we're utilizing it, and then also that we are accelerating all of our wait times and door-to-door times by utilizing that technology properly. And then the last thing that I really emphasize here is when we've got our operational rigor tight, then we can lean into capacity management. And you might ask, what is that? So capacity management has 4 pillars by visit type. And this is where we can go into what I would call the next level of urgent care, operational, and financial health. And so capacity management prioritizes and intelligently prioritizes patient demand, your clinic resources, which is mainly your staffing, and the cost associated to it. So the cost of staffing, as well as how much you're going to get paid for those visits. And then the throughput for those visit types. So throughput or door-to-door time. And then when we zoom out for all of your visit types, we are intelligently prioritizing the most in-demand visits with the best revenue outcomes. And then we're going to take the least in-demand visits with the least valuable revenue outcomes, and we're going to deprioritize those. Okay, so if you ever want to see how that math works, feel free to reach out to me. I actually have a pretty easy tool that I can ingest your data into, and we can take a look at that together. All right, so math aside, your people, again, are the most important, and again, the heartbeat of your business. So I encourage you to start with your people and then go from there. So speaking of people in urgent care, I want to share a little story that has happened in the last few weeks in urgent care. So I want to highlight somebody who has been active on urgent care social media on LinkedIn, and he is a recent co-founder and CEO of a recently opened urgent care. And he's Dr. Wasim Ghanem, co-founder and CEO of After Hours Urgent Care in the Charlotte area. And not only is he hilarious in general, but he took to social media, to LinkedIn, to expose the difficulties of credentialing with United Healthcare. I'm going to pause on that because we all know that there have been just some general difficulties with United Healthcare in healthcare in general in the year 2024. And so, what I appreciated was he started out just being very real about the struggles with credentialing because it's preventing access to care in his community. And I also appreciate the hours of this urgent care. I think they're open until 2 a.m. So they truly are after hours urgent care, preventing people from going to the ER. So first he took to LinkedIn with a video that was exposing him being on hold for forever. And when I watched that, it was truly triggering because everybody has been on hold like this. And when I heard the music, I was like, oh my gosh, it took me back. But the second video he did, you have to watch it. He is dressed up as Elton John, singing to United Healthcare about being in his feelings about his credentialing paperwork and he not going through and not getting approved. And he's in a wig and he's playing the piano. Actually, I'm not sure if he's fully playing the piano, but it's so good and you need to go watch it. And I think it was within a week, United Healthcare approved his credentialing. And that, I'm eagerly awaiting his white paper called Urgent Care Strategies in Contracting, Credentialing, and Corporate Shenanigans. And I just really appreciated this online content. I'm looking forward to more from Dr. Wasim Ghanem. I appreciated his work, and you should go take a look at it.
And we'd love to hear your urgent care stories if you have them. Of course, all stories will remain anonymous, so please don't share any identifying information. If you do, it will be removed. If you'd like to do that, I've included contact information in the show notes. Thank you so much for being here and sharing all of this great information and considerations in these areas, April. And listeners, thanks again for joining us for Inside Urgent Care. See you next month.